Thank you. Thank you for joining us today. Good afternoon, everyone. I love these monthly webinars. We get to see everyone. We get to see all of you coming into this space to share space with us. We're honored to have you. Thank you. Thank you for joining us today. Giving folks a couple minutes, you know, the Zoom space. Once you open up the door, everybody start popping in. Thank you for joining us. Thank you. Thank you very much. We're really excited to have everyone here with us today. We're going to ask you to mute yourselves so our technician doesn't have to mute everyone. We will ask you to unmute when you're speaking, but if you're not speaking, please mute yourselves during the conversation today. We have a really exciting conversation. I do know that many of you have already heard that Ribbon and the People Living with HIV Caucus is creating a commemoration, 40th commemoration of the Denver Principles. So we thought, what great way was it to begin to bring the conversation? Thank you, Valerie. Thank you, Paul. What great way was it to bring that conversation as we're hosting those events? June the 9th through 14th. So there are a number of events that are happening. Our communication person, Heather, will be dropping links into the chat throughout the day so you'll know what's happening. But we thought, what a wonderful way to start the conversation, and with some of our auxiliary partners in this opportunity, as well as with all of you. So today's webinar is titled The Denver Principles, Saving Our Lives Then and Now. For folks who don't know me, I am Linda H. Scruggs. I am one of the two co-executive directors here at Ribbon. Ribbon is a national nonprofit located in Largo, Maryland, right outside of the nation's capital, for folks who are not familiar with this area. That's who I am. I go by she and her pronouns. I would love to invite you to go into the chat. Tell us who you are. You're welcome to share your pronouns. You're also welcome to share where you're from and any one thing that you might want us to know. As you're doing that, we would love to know who's here. We want you to know who else is here. But again, thank you. Today's discussion, as I said, will start us off in a series of events and activities that are happening not only with Ribbon and the US HIV Caucus, but we do know that there are a number of groups and networks who are doing things this year as we're celebrating the Denver 40. I will tell you just very briefly, our conversation around the Denver 40 really is a celebration. So it's not just noting that the document happened, that the action happened. A big part, hey, Ronald, my colleague, Ronald Johnson from the caucus is here with us. A big part of what we chose to do was to acknowledge the 40-year commemoration is happening, but also we really wanted to honor all of the work that has happened to implement what happened on June the 13th, June 12th, 1983. We thought just as important that the gentleman took the stage. A lot of people have advocacy actions and it just happened. But something different happened as a result of June the 12th, 1983. What happened was thousands of us have taken charge, and we've taken that work that happened and we've been able to implement it in many different ways. That what the principles have showed up throughout our organizations, throughout our individual past, whether we're persons living with HIV, we're allies to the HIV community, or we're persons impacted. And a lot of what our celebration space is around the work that happened as a result of the Denver Principles, of that moment. So we're really here this year celebrating you, all of you that have stood up and decided that you were going to do something different. You was going to be part of the change that you wanted to see or needed to see in the world. As a woman diagnosed with HIV, I first learned of the principles in 1992. And I love telling people I was diagnosed in 90, and almost every training that I've done since 1992, I've started them with the first homework is, what is the Denver Principles? They really are a banner to me personally. but I'm not here to talk about that. Let me go. I see all the folks are chatting. You're putting in who you are here with us. I want to introduce our panelists. Two of our panelists I see with us. I think one of our panelists is delayed in traffic. She may join us. We hope that she's able to. But our first two panelists that are here with us is Jessie Mallon. Jessie is the CEO of AIDS United, and Scott Bertini is with us from Health HIV. Our other panelists, as you know from the flyer, will be Dazon Dixon, the founding executive director of Sister Love. Dazon, I hope, will be able to join us when she comes in. We're going to pop her in and keep it going. So first of all, I want to just give a moment to Jessie and Scott to introduce themselves and around framework on how did the Denver Principles influence your organization, advocacies, and efforts. And we're really talking about then and now. And we know both of our panelists, all three of us, Dazon has spent her life at Sister Love, but some of our panelists also come from other places, have had other experiences in their workspace. So I really would love, Jessie, can we start with you?
Absolutely, absolutely. Thank you so much, Linda. And thank you and Ribbon and the U.S. People Living with HIV Caucus for creating this commemoration of the 40th anniversary of the Denver Principles. We spent a lot of time just a year or two ago commemorating the 40th anniversary of the identification of the AIDS problem and the epidemic. But I think the Denver Principles is a different celebration. It's celebrating how our work and how our people's how their voices must be at the table, because meaningful involvement of people living with HIV and AIDS is the essential element of the Denver Principles that I think we have been able to implement and advocate for at all levels of government and all levels of the HIV response domestically. So I'm a person who's been living with HIV for 40 years, and as CEO of AIDS United, I am thrilled to help oversee our strategic grant making, our capacity building, and our advocacy. But in the work that I've done before I came to AIDS United, I was AIDS director for Philadelphia. I was the lead for several projects at the CDC in a prior organization, and I chaired the Federal Advisory Committee on HIV for both HRSA and for CDC. But I can think very clearly about the impact that I particularly saw on the Denver Principles when I was doing speaking tours for the State Department in Africa. And I saw the importance of NAPWAs, of national organizations of people living with HIV or AIDS, to help push their governments to do something to respond to the epidemic. And that's what we've been doing since the Denver Principles were created here in the United States. We've been pushing our government to do something. The 30th anniversary of the Ryan White program is an outgrowth of the first decade of advocacy that our people did. And just this year, we celebrated the 30th anniversary of AIDS Watch, which is managed by AIDS United, but was started years ago at the US NAPWA, the National Association of People with HIV and AIDS. And I think that is the legacy that we are trying to hold on to at AIDS United, to keep the flame of what was started 40 years ago that has been ignited through the advocacy that we do every day, and that AIDS Watch, I think, is emblematic of bringing the voices of people living with HIV and vulnerable to HIV directly to decision makers in the United States Congress. And so that aspect of our work is critical, but it is work that I think has helped state for the nation how our efforts to not only transform what is needed at the federal level, but also at the state level. We managed this year 2 AIDS Watch at home at state legislatures in both Sacramento and in Albany, Georgia, and in Georgia. So we've had real strong efforts to make sure that the message of meaningful involvement of people living with AIDS and HIV, and that our voices are being heard directly by decision makers, is a reason for our existence, and it will continue to be a role that AIDS United plays. So I hope that's helpful.
No, that was fabulous, Jesse. I'm already excited. So, folks, if I'm over here grinning or if I go off track, it's okay because I will tell you I am so excited to be having this moment, not just today, but this whole commemoration have been really special to me. Hey, Scott, come on, tell us a little bit, introduce yourself, but also whether in health, HIV, and other places, how has the Denver Principles really influenced your organization or the advocacy efforts with you?
You know, I would echo everything that Jesse had said and really appreciate the time and effort that you guys put together to have this moment in time so that we could afford the individuals of that legacy of the Denver Principles a time to renew it and renew our hope and renew our vows to it. You know, 1983, gosh, AIDS was still at its most fearful peak, and the virus that it caused was still pretty much unnamed. And at the time, AIDS activisms, as we know it today, it was still mostly localized and was confined to neighborhoods that were often impacted by communities who could least afford their health battles, right? But in June, the National Lesbian and Gay Health Conference in Denver, a group of individuals with AIDS from around the country, they met to compare notes and strategize. And their work produced this manifesto that became known as the Denver Principles. And it forever changed, like Jesse said, how AIDS service and aligned CBOs organizations, how they operate. And it was the first time that a group of individuals living with the disease had organized to make their opinions, to make sure that they were taken into account when decisions about their lives were made. And it was a bold repudiation of like paternalism and a milestone in the history of human rights. And I am a direct recipient of those principles. So in 1990s, when I moved to Denver, and I was diagnosed right at the time when protease inhibitors came online, that moment in history of the Denver Principles spoke truth to power 12 years later when I was diagnosed and figured what my path forward was. At first, it felt as though there was a victimhood in a sense, right? That we were blindsided by a disease, but there were providers in Denver General, like Dr. Rebecca Gass and Dr. Mark Thrum and others, who took that notion into heart and said, you are a person and you have meaningful involvement in your life right now. And the principles, they inspired me to ensure that I would move forward, that I would be standing on the shoulder of giants, and know that those individuals who would come before me had put up these rights, these principles, so that I could live forward and live out loud with it. So it is the beginning of meaningful empowerment. It is the involvement of all of the work with the Public Health Service Act, the way that providers looked at individuals, how we do screening and tools and diagnostics and policies, everything from access points and whatnot. So the Denver Principles are the history of human rights.
Wow.
For
Wow.
those, I'm our director of advocacy at Health HIV, and I also lead the Living Positively program that is sponsored and part of the organizing center that Rock works with, and all the partners here together. So I just want to say thank you for this opportunity to share a story, but know that the stories that I'm sharing come from individuals long before me.
Wow, thank you, Scott. I'm loving the chat and I love that folks are in there. I'm just going to call one out real quick. Taz Anderson wrote 1983 is the year I acquired HIV. So the Denver Principles and my virus are 40, and Scott and Jesse and I all talked about being diagnosed in a period, and I love people telling folks, my doctors was wrong with the diagnosis and the date of death that they gave me. And I'm so happy for them that I didn't even file a malpractice suit against them, right, for having a wrong diagnosis of death. So I love the fact that we are here. So many of us are here. We're aging. Many of us have aged along this Denver Principle continuum. And HIV and aging is a big conversation. It's kind of how we're here today around this aging piece. We really talked about how the Denver Principles, our theme this year is from patient rights to human rights. a lot of people around the country are talking about how the principals, folks in San Francisco here, there's the San Francisco principals, there are the Atlanta principals, there are a number of folks who have gotten together and started looking at how do we create the principles in a relevant space that way we live today. And I really want to go to the human rights part of our theme. And Jesse, and I'll start with you again, is have AIDS United, how has AIDS United incorporated or focused on the human rights of HIV today in the work that you're doing at AIDS United? Can you speak to that a little bit?
Well, thank you, Linda, again. The Board of Trustees at AIDS United just adopted our new strategic plan, and it's leveraged on the plan that we created in 2018, where our mission statement was clear that we were about ending the epidemic in the United States, but we never had a vision statement. And so we created a vision statement that says we want to create a world where all people, all organizations, all governments are committed to the health, the well-being, and the human rights of all people living with and vulnerable to HIV. And adding the words human rights was a conversation at our board level, but we decided that it was important to expand that, because if you don't have human rights, then you don't really have a full citizenship in your country, in your state, or in your city. And if you're not a full citizen, then how in the world can you be treated as a whole person? And so it was important for us to do that, and our board just reaffirmed that in approving our new strategic plan in March of this year. So we've also began to understand that human rights, which I think too often in our community, we think only relates to LGBTQ rights. Yes, that is important. But in the last couple of years, we've seen the importance of accelerating our advocacy for voting rights, for immigration rights, for reproductive rights, for the right to attend the school that you want to attend. Those aspects of human rights are important. And I'm not in any way suggesting that our continued advocacy for LGBTQ rights is in any way diminished. It is critical, but we have to understand that we have many issues where the human rights of people who are living with HIV are impacted, because we are whole people and multidimensional. If you're a Black woman in Mississippi and you can't get to the voting booth on time because they closed it too early, then your rights as a human have been diminished. And so we are looking at those broader issues as well as the critical issues that do specifically impact people living with HIV, like criminalization laws. Those impact our human rights if you can't even feel that you can share your HIV status without possibly being arrested and going to jail. And then, of course, we have the issue of Medicaid expansion and the very right to have access to health care. We still have over 10 states that have refused to expand Medicaid, and it's mostly about expanding it to people like us, and like so many of us in the HIV community, who are not otherwise eligible for Medicaid because we are not parents of dependent children.
Yep.
And I think we need to just remember that we are already operating at a disadvantage in those states where Medicaid has not been expanded, because it's denying the basic human right to access health care and have health insurance simply because you may not be an impoverished person who is living with dependent children. So all those aspects are what we at AIDS United are working on today.
I love it, Jesse. We're going to be having a webinar soon on human rights, and you're absolutely right. I love, again, the chat is on fire over here. We're talking about housing rights, and we're talking about the whole person, right? So not just how I show up in the healthcare system, but how do I show up as the whole person, my whole unique self in me. Scott, I'm going to twist yours a little bit because I want to talk about, the advocacy element, like what is or how might Health HIV be working with and looking at how patients can or are part of the advocacy space of HIV in the human rights space. If you can speak to that lens around the patient and the work you're doing.
Yeah, no, and again, to echo, like, as a person living with HIV myself, I'm more than the sum total of what my viral load is. I'm an individual that has the housing needs, food needs, outpatient ambulatory care needs. I'm an individual that has mental health and behavioral needs. So looking at a person living with HIV through Health HIV, how we do it is clear, right? We have to take into account the whole aspect of what a person is. So we focus in on whole person health. And that often looks around how do we create opportunities around even data points, right? How do we encourage individuals to self-identify through SOGI data, sexual orientation, gender identity data, but also include sexual characteristics to that. So there's so many ways that I think Health HIV works to integrate our human rights into patient rights, which translate into access points and then policy and program. So a lot of it is built on advocacy. It's built on capacity building. It's built on technical assistance. It's built on advocacy through coalitions that we work with. And, I'm so glad you said about criminalization, right? So I led the effort in Washington State to defelonize HIV exposure without intent by modernizing the STI laws to ensure that individuals' rights were taken into account. And we involved people throughout the entire stakeholdering process through that so that there would be not forever determined by a communicable disease, right? Like I said, we're more than the sum total of our viral load. So we look at the disproportionate environment in which HIV is fueled, and in geographies and communities that are stretched thin by few resources and even fewer healthcare access rights, these influencing factors in which we're born and we grow and we work, we live and we age, they're so integral to the story of us and our health. And that is embedded in all aspects of Health HIV's mission. And, we talk about it first, Health HIV, we are one word. And there's a lot of room to grow within those two words. So I think it's a matter of looking at individuals through the lens of non-HIV, but through the lens of what their issues are, what their needs are, and how do we treat them as whole persons. So I would echo everything.
Wow. Thank you, Scott. I'm still in the chat. Folks are giving out some beautiful gems in the chat. I want to ask for a second, and I'm going to open up the lines in just a minute. If the audience, if the group have any questions, please drop them in the chat. Staff, we will pull them up and tend to them. I want to just go back for a second and think about part of my thoughts is around, the patient rights to human rights and where we are today. And this is Linda's theory. I can't even say this is Ribbon's theory. This really is Linda's theory that part of the community, we've taken the urgency out of the need to be advocates, right? So how the need to elevate our voices. And I want to throw this out to Jesse, you or Scott. What would you say to the community if we're talking about the need to elevate our voices? Is that just me thinking that some of the voices going away from our fight?
I think it's not just a question of elevating our voices in terms of speaking louder. It's taking our voices to higher places where we haven't thought that our voices could be heard. Not just our voices, but our roles could be offered to us, or we could build roles for ourselves in places we never thought. I'm looking at Vinton Jones. He was just elected to the state legislature in Texas, a man living with HIV. Did any of us think it was possible for you to share your HIV status openly with your constituency and win an election and get to be in Congress or into the state or the state house as a person living with HIV? I think that is built upon 40 years of advocacy, and it's just beginning for us to be at that level. Talk about elevation. Let's go from the Texas State House to the governor's mansion, to the United States Congress, to the White House, to any place where our role, our voices can merge, as I thought, as Scott just said, health and HIV integrated into one being for us. I think that's a wonderful role, that it's not something separate. It's who I am, and I can say so much, not just for the HIV community, but for the broader community, because my advocacy has been honed in the HIV community, and I am part of the broader community as well.
I love it. I love it. Scott, before you go, I got to acknowledge that the lovely Miss Dazon has joined us. She has some challenges, but she's here with us. Hey, Dazon, come on and just say hello to everybody. You got to unmute yourself.
I'm trying to find it. Y'all know I have no idea how to do Zoom on the phone. So I apologize for not being with you all from the beginning of this conversation, but I'm excited to be here now. Hey, everybody. Hey, Linda. Hey, Jesse.
Thank you, Dazon. Dazon, we're going to jump you into the conversation. Scott, do you want to talk about, respond to, like, how are we, or how can we elevate our voices as the advocates around the human rights space?
Right. You know, when the ACA happened and we all thought, oh, fantastic, we can now talk about health equity as being at the forefront of the world. We all have access, right? What we've learned that is, just like Jesse is saying, is that we're at the forefront of what that advocacy efforts have brought to bear right now. We have de-exceptionalized AIDS, but we haven't moved officially towards a status neutral approach, because there are still issues in which people that are aging with HIV still have exceptionalized needs with respect to policy. So it involves getting them involved at the state level and at the federal level to ensure that diagnostics and treatments and screenings and mental health and all the things that need to be are included for them. But it also means taking a step back and looking at us from the social determinants of health, right? The things that bring us to the precipice of disease states, right? We are not AIDS, we are not HIV, we're not Crohn's disease, we are not leukemia, we are individuals. So what that then means is we have to take into account, how do we get those efforts moving forward? And it clearly involves getting people more involved in this work now more than ever, simply because we have been able to achieve some kind of stasis with respect to some infections. People are still being marginalized. People are still losing health equity positions day in and day out. And we see it within individuals from the early days of the 1980s to the same moments that we have today. The same individuals are being affected. So we need to catapult ourselves into this conversation in ways that, just like Jesse said, it's policy, it's positions, it's political, it's people, it's family, it's conversations. It is looking at us as more than the sum total. And I'd love to hear Dazon thought as well. So
great. Thank you, Scott. I'm coming to Dazon right now. Dazon, we're having just a quick chat on asking if we're thinking about kind of the HIV space as we are now, and we're talking about elevating the voices. I almost want to go to you around elevating. Is there a need to elevate the voices of women, or the impact of women in marginalized communities as a whole? What should we be saying? How can we motivate this community of folks in this space where we're talking about moving to human rights?
Yeah, so thank you all for having me. And I will just start out with my own apologies. I am actually excited to be where I am. Corrine says hi, by the way. We are actually in Rotterdam attending a meeting between the university here and AIDS Funds Netherlands, focused on a new cure research initiative. And so Corrine and I have been invited in as a part of this conversation for a team of people who are seeking funding for the HIV cure research. And it's really refreshing to be in this meeting, because we're talking with a group of people. For example, it seems from a research perspective that they have actually embraced just about all the parts of the Denver Principles that matters the most. especially from positioning of inclusion of the voices, making sure that there's equitable engagement of social and behavioral science as much as the medical stuff, working on language, working on making sure that people living with HIV and the community voices are a part of the process. So just being in this space is what it looks like when you make practical and make real what was intended by those original activists who even crafted the principles. So in terms of where we've come from, of course, especially working with women, working with people of African descent, working with folks in the global South, as well as in the Southern United States, is that one of the things we've been very clear about, at least at my organization and within the work we've been doing, is that all of the folks that are affected by HIV most affected by HIV live intersectional lives. And that means that we have to have intersectional responses. And one of the clearest places where intersectionality and justice come together is within the human rights framework, right? So making sure, and this is what I used to do when doing human rights training, which I think we could bring back, is I could take any aspect of the human rights framework as it's formally addressed, and we can do a training on that one day, on the Universal Declaration of Human Rights. If you looked at every article within the human rights framework, you could apply that to the issues of equity and justice and inclusion and access and coverage of healthcare and recognition, because the human rights framework is about dignity and it's about justice. It's about equity and it's about the right to be just because you were born human. And so from that context, what we have to do is make sure that we understand that every issue, every experience that the people who are living with HIV, especially the women who are Black and brown, women who are Black, brown, and queer, women who are Black, brown, queer, and poor, women who are Black, brown, queer, poor, and Southern, you cross it, and parents, that we're talking about needing to access equity and justice in every aspect of those lived experiences. HIV is not the only thing that the Denver Principles addressed for us. It addressed our humanity. It addressed our ability to be whole as human beings. It addressed what it means to live with dignity while living with HIV. And that is still the message that we have to deal with today. Only we have to also make sure that for people who are not living with HIV, these issues are just as important for them. That demanding to get tested for HIV should not have to be a courageous act. That making sure that your clinicians are seeing to your care, including HIV, and not in a stigmatizing way, not in a way that wants to judge your sexual activity, your sexual behavior, your sexual desires, your sexual proclivities. None of that matters if dignity is the center, because what they're going to want to make sure is that you have all the information, that you have access to what's available in terms of the tools, and that you're able to afford them and keep them how you need them, and that there are others who will support you in your ability to use them. So in that respect, I can't imagine anybody thinking that applying the principles, applying the work that we have to do around HIV treatment, care, advocacy, research, prevention, technologies, all of those things require us to use a human rights approach. And I'm going to close it because y'all know I'm a teacher as well, that if we haven't laid it out, there are 5 basic categories. Now, this is the formal version of human rights, right? You don't need laws. Thank you, Paul. Funding, funding, funding. Yes. You don't need Paul Aguilar is here. You don't need laws and treaties and global agreements to actualize human rights from a person-to-person standpoint. We can engage those on our own. Human rights is about civil rights. That means treating people equally under the law. It's about political rights, which means your right to engage in the policies and the politics of your governance, whether it's local, state, national, international, or shoot, Let's go galactical. It is about your ability to be political and have your voice. That's your vote. That is being able to organize. That's being able to run for office. That's all the things that we have to do within the HIV space to make change. It's also about your social rights, which are your rights to healthcare, your rights to an education, your right to housing. All of that is a social right. It's all about your dignity to live in the place that you need to live so you can have access to the things that give you quality of life. It's about your economic rights, right? It's about the ability to earn and have what you need to take care of yourself and your family the way you choose to. It's about your cultural rights, your language, your heritage, how you practice, what you believe, your faith, your religion. It's about respecting all of those things and that people are held with dignity and equity throughout all of those. Those are the 5 original human rights categories. The ones that we've added on are your sexual rights. That's your sexual identity, your sexual engagement, your practice. I got 2 more and I'm done, Linda. It's about your sexual rights. It's about your developmental rights, which means you have the right to develop your communities in the way that's needed within those communities. And last but not least, it is also about your environmental rights. It is about the right to have a proper approach to protecting your environment and the climate. And I'll add on one last fact. What I learned from our very own Director of Office of National AIDS Policy recently, Harold Phillips, was unequivocal in explaining that they already have the data showing by GPS mapping where people will be most affected by climate change in the United States is also where we have the highest incidences and prevalences of HIV. So think not that these things are intersectional. Think not that these things are human rights based. Think not that HIV is the beacon and the North Star for all kinds of social change, not only making sure that people living with HIV get the dignity that they deserve, but that everybody gets the human rights that we all deserve.
Wow. Thank you, Dazon. I know it. You know, that's what she's doing, like Aunt Maxine. She reclaiming her time because she was late. But it's okay. We love you. That was powerful. It's just like the queen to show up and drop the mic. I want to just open up the questions. I don't want us to run out of time. I know that folks have been in the chat. Thank you for responding. Thank you for adding to your spaces. I just want to open up just for a couple. If you want to just raise your hand and we'll bring you in to the conversation. If you
Thank you.
comment, I'm going to ask you to do that now. Nobody's coming up. Nobody's question, no thoughts. I don't see any hands being raised. So let me go into the, do staff see any particular questions? Just give me a second.
You know, I would certainly add to Dazon and emphasize exactly what you're saying is that we have to have accountability and incorporate those identities into the accountability systems and the programs across the institution. And Barbara wrote earlier that, right, human rights are like a wonderful thing, but for individuals who are living with HIV, right, AIDS exceptionalism sometimes does matter in that respect to ensure that you do have those rights and that you are represented at that table. The issue is often is exactly that. It's the funding. How do you, like she said, how do you braid together funding that doesn't incorporate that status neutral approach when there are some serious issues for individuals that need to be represented at that table? So I certainly wanted to appreciate that comment.
Thank you, Scott. Yeah, I did just see that with Barb. Thank you, Barb, for adding that. Also, just wanted to add up, Tez noted when we were talking about advocacy, the important for us, particularly those of us that are aging and working and entering into the aging community. We've been aging the entire continuum of HIV, but we're now, people know I call us the baby boomers of aging. We're the largest generation there ever have been that has aged collectively. And I'm really thankful that we were the largest generation there ever will be because of the advancements of treatment and things. And Paul noted, you know, the magnificent ways that treatment has changed. Some of us remember the buckets and bottles of pills per day, you know, 20, 30, 60 pills per day. So I'm really glad about that. I'm going to ask, Douglas has his hand up and I see Vanessa. Come on up.
No, I just want you to bring attention to Douglas. You got it.
Douglas. Yes, Douglas.
Yeah, thank you for the floor. I wanted to say when the Denver Principles first came out back in 1983, I back then was newly infected. I was very healthy. I was like in my late 20s, and the impact of AIDS didn't really affect me. I didn't feel the impact of it and stuff. But I read the Denver Principles, and I thought to myself, my God, people go to the hospital and they're treated like animals, or they're not even allowed to go to the hospital. The hospital rejects them. I couldn't believe it, and that's what the Denver Principles said to me. What I wanted to ask you now is there a committee convening to reactivate the original Denver Principles, or possibly to update them? Because I know for myself, back in 1983, reading the Denver Principles led me to believe that I was not alone, that there were a lot of other people with HIV like myself, and that we do have our dignity, we do have our self-pride. I'm not a social reject.
That's right.
And there are newly infected people now that I think would need the same kind of thing. So we either reissue the original Denver Principles or maybe update them for the way we are today. Because today, in chat, I was talking with some people. I can't believe we're talking about a cure. You know, back in my day, we had all to do to get treatment. And it took a tremendous effort just to get AZT. And, you know, today they're talking about a cure. They're talking about treatment that lasts for months on end. Will the Denver Principles be updated to speak for the time of we're in now? Thank you.
No, thank you, Douglas. Thank you. And I always love folks when I hear folks of long-term survivor, Douglas. I don't know you, but I love telling people thank you. Thank you for surviving. I love that you have this question. You're unpeeling some of the box that we're going to be talking about as we're talking about the commemoration as we go into June, and that we are beginning to discuss, you know, at the national level, a coordinated, collaborative way to look at how the Denver Principles as the patient document, you know, in 1983, and how and what is the work that we need to do as a collective community to come together to talk about whether there's a rewrite, whether there are amendments, what do they need to what needs to happen. I love, as I noted earlier, there are some communities and states have already done that. San Francisco, Atlanta, Ohio have done that. That's right, Ed, the Glasgow Manifesto. Folks are doing these pieces already. And, you know, what we're doing is really embodying all these pieces, but there is kind of in our early thinking a 2.0 where we will be bringing both national folks together, but also coming into communities, having this discussion on not just what it is, how does it look, but how does it look in your community? You know, if you're in Beaumont, Texas, what does that look like versus if you're in Rainbow, California, or Richmond, California, how does that look? So we are starting to have some of that conversation, and we're really excited that this commemoration is bringing up community together. I know for me, in my eyes, in a different way for the first time in a long time. You know, I was talking to one of the writers of the San Francisco Principles this year and talking about this Sunday, and how do we look at the models that folks have already done that, and how do we work with them to help communities and states replicate that space? So that the Denver Principle, there's a national model, but there's also something that comes down to how HIV shows up in your community in that space. So stay tuned. These models, this work won't happen overnight. Funding, but also really because we are coordinating in different organizational ways. And I love Jesse and Scott, Help HIV, Sister Love, and folks are part of these conversations on how do we come together to really galvanize the community that we really come up the next document, not done in a beautiful hotel, but done really through the community voices, how to, because many of us are already showing up in communities. How do we add something on that we're coming up with what you say, what you heard, and what you're experiencing for this new document, for whether you're in your 80s with HIV or unfortunately you received your diagnosis this morning. Somebody in America did get diagnosed today. So really wanting to look at how do we do that. We got to get ready to close. Before we close, I want to ask our panelists again, or not again, I want to ask you, just with that, if we're thinking about tomorrow, right? If we're thinking about tomorrow, what might be a collective? If we're thinking about organizations who haven't done this, how might an organization begin? Because you can't start at step 5. So if they work at an organization or organization leader, what might be some beginning steps they can do to begin to have the Denver principles begin to live in their space? Let's start with you, Scott.
Nothing about us without us, right? It can easily start with the Ryan White Service Program and the Public Health Service Act to ensure that through the planning councils and the planning bodies that we have the representation so that we can get the services that are necessary to ensure the support that is needed throughout this lifelong journey, right? Some may need food, some may need housing, some may need shelter, some may need others. It's a matter of ensuring that we have participation and stakeholdering, I think, clearly at the Ryan White program process, but it also then includes things like making sure that we're a part of the Older Americans Act, that we are represented at those tables through SOGI data in the STEM federal census, right? It's not just a matter of collecting that data, it's then a matter of looking at what that data means and starting from the beginning of what those social determinants of health are and how do we address that. So it is an incorporation of it's a wraparound services approach. What the Ryan White program is for everyone.
Thank you, Scott. Dazon, come on, and then I'm going to close out with Jesse on his comment. Come on.
So I absolutely agree with Scott. I concur 100%. And I think that it's important for people not only to remember nothing about us without us, but who the us must be. And in the future of where we are, we have to center from the margins. I don't care who's running your organization. I don't care who's in the leadership of your organization. I am a bit concerned about who the face of your organization is and who your people see on a regular basis that look like them, live like them, or at least understand their lived experience and their indigenous expertise. So I think my best advice that we should add into it, other than how we locate HIV in the human rights framework explicitly, but it's also what does it mean and what does it take to center from the margins, not just the focus of the work, but the power, the decision-making, the voices, the lives that matter the most are the lives that are furthest pushed to the margins. And so we have to make sure that those people are in the center, are the focus, and are absolutely the purpose for why we're in this fight in the first place.
Wow, thank you, Dazon. Come on.
Thank you.
You're muted, Jesse. I want you to unmute and come
Yeah,
on.
thank you, Dazon and Scott. I've learned so much just from listening to you, and you've expanded my thinking. And so I want to suggest this, Linda, that the Denver Principles started with making sure that the voices of people living with HIV were heard with regard to our needs for healthcare, our needs for social services, that we were at the table and part of the decision-making process, if not leading the decision-making process. But today, after 40 years, I think what Dazon is helping us frame is that after 40 years, the HIV community can also be about making sure that our values are represented at all levels and in all places wherever any decision is being made or any policy is being created that might have anything to do with our lives. My organization just revised its investment policy. And we had to make sure that our investment policy represented the values of our organization, which is centered on people living with and vulnerable to HIV. So from the smallest question, any one of us could go to our HR department or a vice president of our organization and ask, well, what is the leave policy? And is it really fair for what I need today? But we can use our values, not just in our own organizations, but in any organization in our civic communities that we are a part of or that has an impact on us, from the police department to the education department, to the justice department. We can use our values because after 40 years, which is more than 2 generations, we have empowered ourselves to not be afraid that there should be nothing for us without us. And without us includes our values must be incorporated, or else you are not representing what we want, what we need, and what we want to see change.
Wow, I have so much to say and I don't have enough time to say it. This is absolutely incredible. This has been an incredible discussion. I know it's never enough time to really get to the middle of the onion, but definitely our guest today and you, our partners in this space, have definitely made today a very meaningful conversation as we're talking about just not commemorating the Denver Principles, but I want you to remember the celebration that Ribbon, the caucus, and our partners are bringing you is a celebration of us. It's a celebration of the implementation of the work. Wanda, it is you being tireless, it is Paul, it is Hank, it's Marvelous, it is Valerie, it is everyone's willingness, whether to be the face, the voice, the person. I remember this woman when I was working at Johns Hopkins in the 90s. We would do a state visit every year. And because of the stigma of HIV that was here in 1993, unfortunately, that stigma is still here. But she wouldn't go to the state capitol in Annapolis with us. We would literally give her a roll of quarters. And y'all remember the phone booth. Some of y'all remember. And she would stand at the phone booth with the state legislators' names. And she would say, I live in zip code 21215. I'm a woman diagnosed with HIV and I have 5 children. And she would tell her story. We will have people. So there's a role for everyone when we talk about the implementation. As Jesse said, go to your HR. What are you doing? How do you show up? If you're hiring people living with any chronic disease and HIV, to go to the doctor should be a bonus. I shouldn't have to take sick leave to go to the doctor. I shouldn't have to take sick leave for preventive care in those spaces. It is so important, but I want to thank you all for your commitment to the implementation and the living space of the Denver Principles. Yes, Douglas, there's some work to be done. And you know what? As a community, we're going to do that work together. I want to quickly just share my screen for a second to tell you about a couple of the events, as we've talked about, that is happening over the coming weeks. We will open registration for all of these events. As you know, we're having a virtual film festival being hosted by some of our partners nightly, beginning June 9th, 10th, and 11th. We will have movie together. Bring your popcorn, bring your Coca-Cola, bring your drinks, whatever you want to bring. Come look at a movie together. This is a virtual event. We will have guest speakers following. There will be door prizes and gifts, cash gift cards, and technology will be given out during this event. We're also being hosted on the 12th, the actual anniversary of the Denver Principles. Through this program will be hosted by the People Living with HIV Caucus and some of our auxiliary leaders. There will be a gathering. We're going to invite you to please come and be with us in this learning moment, this celebration moment, and those in the arts. On the 14th of June, we will actually be in DC. For folks who are in DC, please text, email us, let us know you're here. We're going to be on the Hill. We're going to be having congressional visits. We're doing a congressional briefing hosted by the Ribbons Organizing Center Action Policy Group, talking about just what we've been talking about, the impact of aging with HIV. And we're following that DC event with a reception, an awards reception, where we will be celebrating we have one founding member from the Denver Principles, Richard, will be with us, and some other fabulous people will be with us that night. Want to thank you for, hopefully you can be with us, if not on all of them, at least one of them. And again, this is not just Ribbon and the Caucus. We have sponsors and some great partners for this event. Please, please, we didn't create this moment for us. We're creating this moment for our community, for us as a collective. Ronald, I know you didn't plan, but you want to say something? We got like 2 minutes before I want to tell people we're going to have the community voices. I think Heather is putting in the chat something. If you want to share your voice, this is a way to share your voice. We have some contests going on. We got evaluations to this webinar. We want to hear from you. I am going to give way to Ronald. Go ahead, Ronald. What you want to say?
Thanks, Linda. And I won't take much time. I just want to say thank you to Scott, Jesse, and Dazon for getting us rolling on this celebration and this recognition of the Denver Principles and what they have meant in history, what they mean today, and what they must mean tomorrow. And I want to thank all of the participants who joined us here to get us started on this celebration and this journey to not just rewriting the principles, but reaffirming them in the actions that we take. Thank you.
Wow. Thank you, Ronald. Thank you. Again, to our panelists, thank you. We couldn't have did today without you. This was absolutely fabulous. To our guests, please, again, thank you. Please take our sincere, heartfelt thank yous. We want to do this work with you. We want you to come back with us next month. We will be having a celebration. We'll talk about some of the things we did. As I noted in the chat, we have some cure research conversations happening soon. We have some other policy things happening. Please don't forget to visit us. I will acknowledge, I saw someone also put in the chat, the Reunion Project. All of us are working together. Right. So we love and we want to highlight what they're doing. They're doing a series of long-term survivorship opportunities for learning and engagement. If you have things you want us as a community to highlight, please send them to our website, to our email. I think folks have it as you've already registered for this event. We want to get your stuff out as well, what you're doing. So we are as a community are learning together and committed to each other. It's not one of us. You know what I've learned? I'll tell you this from my church. One fight, one issue, we all win. Only if we do it together. Let's do this together. Let's do what we haven't been doing. This is coming together, recreating a community of unity, a community of what we were driven on. Thank you, everybody. Have a fabulous week intentionally. Be safe into this Memorial Weekend. Please, please, thank you. We look forward to seeing you soon. Thank you for kisses, Dazon and Kareem. They didn't take me with them, but it's okay. So again, everyone have fun and thank you very much. Paul, thank you for showing up. We love it. Thank you very much, Sarah, being with us. Barry, thank you. Have a great day, everyone.